It is time now for Morning Rounds. Joining us are CBS News Chief Medical Correspondent Dr. John LaPook and CBS News contributor Dr. Holly Phillips. First up, some promising news about children and autism. John?
Vanita, a new study out this week adds to the growing evidence that early detection and intervention may be key to effective treatment.
At first glance, Diego and Emilio Aguilar look like typical brothers. But at age 2, Diego was diagnosed with autism. So when Emilio reached 6 months, his parents, Carmen and Saul, had him tested.
We were told that Emilio was showing delays across the board. That same pain in my heart came back.
Developmental milestones can vary widely among infants, especially before 12 months. But researchers have flagged certain behaviors that may be early signs, such as staring at objects with unusual focus, abnormal repetitive behaviors, and delayed communication and interaction, like poor eye contact. Sally Rogers and her team at the Mind Institute in Sacramento studied 7 infants ages 7 to 15 months with severe symptoms of autism, but no official diagnosis, to help measure the effects of intervention months or even years earlier than usual.
They tended to have a pretty neutral facial expression. These were quiet babies who, if they vocalized at all, didn't really vocalize in a social way.
Oh, shoes.
Over a 12-week period, parents were trained to help their children better engage with the world. By age 3, 1 developed autism, another had a mild form, but 5 had no symptoms. Emilio was one of them.
I don't know what would have happened to Emilio had we not participated in the intervention. What I do know is that our son does not have a diagnosis of autism and is an amazing 4-year-old.
Sorry.
Much more study will be needed to see if this approach truly makes a difference. But the Aguilar family isn't asking for proof.
I heard you say there much more study is needed, but this seems really encouraging.
Right. I would use the word tantalizing. I think you have to keep in mind this is a very small study, 7 kids, and we're not sure that all of them would have gone on to actually develop autism, but it's part of the arc of what we've been seeing in this field, which is towards earlier diagnosis, earlier treatment. We know that intervention can make a difference, and can you imagine if you could identify kids less than 1 year old and intervene then, it really might make a difference.
Oh, because I've always heard 3 years old. That's sort of like when the real symptoms are there. Why is it so hard in younger children?
Right, you know, Vanita, I think it's because of that. Many of us have a misconception that the signs of autism or autism spectrum disorders don't present till about 18 months or even age 2 or 3. We now understand that there are signs even shortly after the moment of birth. Also, all kids develop at different paces, even in kids who are not on the spectrum. So I think as parents, or even as care providers, we're not entirely sure what to look for when. But John, even though this is a small study, I still find it to be so kind of empowering for parents, because while we're still looking for a definitive cause of autism, whether we know there's genetic components or environmental, we can still really also focus on a cure while we're still looking for that cause. So I think it's really sort of good news for parents who want to get out there and protect their kids.
And if not a cure, at least effective treatment.
Precisely.
That's the first time I'm also hearing right after birth. That's really interesting to know. All right, also this week there is new concern about a link between certain sleep and anxiety drugs and Alzheimer's. Researchers in Canada found that seniors taking medications like Xanax and Valium for longer than 3 months had up to a 51% higher risk of dementia. So Holly, what medications are we talking about?
Well, this is a class of drugs called benzodiazepines. They are primarily used for sleep and anxiety. You might know them by common names like Xanax or Klonopin, Ativan, Valium. And they're really, really common. There are more than 100 million prescriptions written for these drugs every single year. And a lot of those are to seniors or the elderly, who are actually the most likely to get complications.
Is it just sleep and anxiety that these drugs are prescribed for?
Well, they're used for a whole host of things, but I think in this case, when we're talking about dementia, remember there's a problem. People with dementia tend to have more anxiety and more problems with sleep. So it may just be that these medications are being prescribed after they start to have the symptoms of dementia. So you can't really say cause and effect, but I think, you know, the take home here is that these are medications that can really affect the elderly.
But researchers right now are saying this is of major importance for public health, which I think with so many people who are using these routinely, they wonder, are they safe?
Well, I think this is yet another reminder that medications have side effects, and there are risks and there are benefits. You have to take a deep breath here and not so much talk about whether they're causing Alzheimer's, because I do not think that this study showed that. But I think it's a reminder that they are active pharmacologically. They can cause problems with memory, problems with gait, and ataxia, meaning that you have loss of balance. So if you have an increased risk of fall in the elderly, that can be a big deal. A broken hip can end up being fatal. So I think it's just another reminder, if you have to use medications like this, they can be effective, but use them in the smallest possible dose for the shortest possible period.
I always know it's really good information when you're both nodding at once. I saw a lot of nodding in that.
As long as we're not nodding off.
Well, there's also some new advice from the CDC on your kids' diet. Cut back on the salt. The government says 90% of school-age kids eat too much sodium. They consume on average more than 3,200 milligrams a day, far more than the recommended 2,300. The agency says that is setting them up for a lifetime of health risks like hypertension and stroke. 40% of the sodium in a kid's diet comes from 10 foods they love to eat, like pizzas, sandwiches, and chicken nuggets. School cafeteria food is only part of the problem. An estimated 1 in 6 American children already has high blood pressure. Hundreds of kids across the Midwest could be victims of a serious respiratory virus. Many of the children needed to be hospitalized after having trouble breathing. It is spreading well ahead of flu season, and the start of the school year is only making it easier to infect other kids. So what kind of virus is this?
It's called an enterovirus. It's very common, 10 to 15 million people are infected every year. The main problem is that it can affect the respiratory tract just like the common cold does, except for if the kid is very small, right, and you have small breathing airways, then when you develop wheezing, there's not a lot of reserve, and a lot of these kids are ending up in the hospital.
But you look at when this outbreak started, which is in mid-August, and it certainly feels like the cases keep piling up. How is it spreading?
It's spreading like the common cold, so through the air, but also on surfaces. And of course, kids are always touching each other and putting, adults even do it, but putting their hands above the neck, in the mouth, in the face. So you try to keep your hands down, wash your hands well. We talked about when you wash your hands, singing happy birthday twice and doing all that stuff. But look, at the end of the day, it's very tough to have kids not spread things to each other. That's what they do.
Well, finally this morning, the Wall Street Journal says couples on different sleep schedules can expect marital conflict. Experts say that spouses with out-of-sync routines have less satisfying relationships. They spend less time together. They have less sex than couples who sleep during the same hours.
So much for absence makes the heart grow fonder.
Let me see if I get this straight. So if you want to have more sex, you should be in the same room at the same time, and both of you should be awake.
It seems so logical.
We're going to have to get some research. Yeah, that's not yet proven.
For this study.
Dr. John LaPook, Dr. Holly Phillips, thank you both so much.